Today we're here to talk about the difference between a psychologist and a psychiatrist, which is a question I get asked all the time. The easiest way for me to think about this is in terms of, first of all, how they were trained, secondly, what they do, and thirdly, language, so what the words themselves actually mean. So firstly, how were they trained? Well, a psychiatrist is somebody who's been to university and studied medicine, and then they've decided that they're interested in mental health and they've gone on and studied the treatment of mental health. A psychologist is somebody who's been to university also, but they've studied human behaviour, and more recently they've started to study neuroscience, or the brain and how it relates to human behaviour. What do they do? A psychiatrist is somebody who diagnoses and treats mental health issues. So a psychiatrist can prescribe you with medication. A psychologist is not able to prescribe medication, so they will offer other interventions, other psychotherapeutic treatments such as cognitive behavioural therapy, or acceptance and commitment therapy, or narrative therapy. Generally they're looking at your whole functioning, so they might be looking at your thinking styles, they might be looking at how you manage your emotions, they might be looking at your wider environment and how you relate to other people. So their study or their treatment interventions tend to be a little bit wider focused than a psychiatrist. Lastly, what do the words actually mean? So if we break the word psychiatrist down, we have psyche, which means soul or life, and we have iatrist, which is medical treatment. For psychology, we have psyche again, which is life or soul, and the study of. So a psychiatrist is somebody who medically treats the soul, and a psychologist is somebody who studies the soul.